going to talk about Zika with Dr. Albert Coe, Professor of Epidemiology at Yale. Thank you so much for being here. There's a lot we don't know about Zika. Where did it come from? Let's start at the very beginning.
Okay. Well, thank you very much, Anne, for inviting me to your show. So Zika started in, if there's a place that we believe it started, it was in Africa. It was probably there for centuries, if not millenniums, circulating mostly in the wildlife. So it's a mosquito-borne disease. The cycle is pretty much believed to be transmission between mosquitoes and non-human primates and monkeys. From there, it spread to Asia. We don't know when it happened, but it's been circulating for over several decades in Asia. And then it started to cause these explosive outbreaks in the South Pacific and in the Americas.
Did it morph at all? Did Zika morph, or has it stayed the same disease from the primates?
So we really don't know the answer to that question. It was actually quite important work done by researchers at Rockefeller Foundation, who eventually came here to Yale and started the Arbovirus Research Unit here at the Yale School of Public Health. But back in the 40s and the 50s, they actually were these proverbial microbe hunters, and they went to Africa. They found it there. But within that period, between 1947, when it was first discovered, to the 1960s, there were probably only a handful of cases that were ever described. So we really don't know, how it changed over these decades when it went from Africa to Asia and then caused these large epidemics.
Your specialty is infectious diseases, and especially in the slums of Brazil.
Right.
Where's the hotbed of Zika right now, or are there several hotbeds?
So there are several hotbeds. Much of this started when, and we don't know exactly when, it may be as early as 2013, as late as the early 2015, when Zika went from the Pacific Islands to Brazil. It started in the northeast of Brazil, including the city that I've been working in, or our group has been working for the last 25 years.
And you've been there 3 times in the last 2 months.
Right, exactly, and specifically because of this response to the outbreak of Zika. But that happened early in 2015. There was an introduction, a large epidemic that spread throughout the northeast of Brazil, and then spread subsequently to other parts of the country. That epidemic now has spread throughout the Americas, sort of like wildfire. So it went to Colombia, Central America, now in the Caribbean, affecting also Puerto Rico at this moment.
How alarmed should we be about Zika? The government is throwing millions at this. Lots of folks are trying to find a vaccine. How alarming is this? The CDC has gone to level 1. Is that the highest level?
No, there's several levels above that. At this point, the Zika virus is not a major threat to the public health threat to the United States, in the sense that we don't have what we call autochthonous transmission or transmission in the United States, except for Puerto Rico. At this point, many of the cases are cases imported, in people traveling, who've lived in areas where ongoing transmission is coming and then returning to the United States.
So 358 cases, according to the CDC, are now reported in the United States. All travel cases, correct?
Those are all travel-related cases, exactly.
How could this get out of control in the United States?
Well, so in the United States, we do have the mosquito that transmits Zika virus, as well as other mosquito-borne infections, such as dengue and chikungunya. These mosquitoes are called Aedes mosquitoes, and particularly there are 2 species, Aedes aegypti and Aedes albopictus. These species are much more prominent, or there's much more infestation in the southern parts, particularly in Florida, the border regions of Texas. There's actually roughly 30 states that have these mosquitoes can be found, but actually the risk for transmission is fairly low when we compare it to places like Haiti or Puerto Rico or Brazil or Central America, where the epidemic is happening.
What about travel for women of childbearing age? What are we telling women? There are a number of cases. We have one case in Connecticut, Florida 82, New York 54, Texas 27, and as you said, Puerto Rico. You're starting to see some more cases. What do you say to women who are of childbearing age?
So my experience has been, very much limited to where we're working in Brazil. We work in the city of Salvador, which is a large city of 3 million people in the northeast of Brazil. It's one of the epicenters of the Zika outbreak. And there, where the risk is actually quite widespread, there's a very tangible and important risk that women have, particularly because transmission can occur year-long. In the situations that we're there, we tell women many of the guidelines which the CDC have been proposing, such as to use protection, to use
because it is sexually transmitted. We've found out.
Well, to use protection against mosquitoes, and,
right.
and in a situation where we've been working in Brazil, the majority of the transmission is mosquitoes. Mosquitoes are much more efficient than people in transmitting this disease. One also has, as many of the reports that the public has been aware of more recently, is that there can be sexual transmission between partners, and that transmission is a potential way of dissemination and spread of the virus. But in a place like Brazil and much of the places where the epidemic has really spread like wildfire, the majority of transmission is really mosquito-borne.
What does the World Health Organization think is going to happen with Zika? Does it know?
Well, I think it's very hard for the World Health Organization or any of us to really know what's going to happen. And there are a couple reasons why. One is that the transmission of Zika is very much like rolling of a dice. We don't know when and how it's introduced. We know that, as of course the experience in the United States is that it can be introduced to areas by travel. It also has to be introduced in the right time, when there is a high abundance of the mosquitoes which transmit the disease. There also have to be the proper climatic conditions, which, for example, temperature and humidity, which allow the mosquitoes not only to survive, but the virus to more efficiently propagate in these mosquitoes.
Let's talk about what symptoms are. If you are bitten by a mosquito that is carrying this disease, what are the symptoms?
So, from what we know now, which is actually still limited, is that in many times the infection doesn't cause symptoms. It may be asymptomatic, or what we call subclinical or inapparent. It doesn't really cause an overt illness. Based on current information, which may change, believe that the majority of infections, 80%, are asymptomatic, and that can cause.
So you don't even know you have it.
You don't know have it. And that can also be a problem. Among those who develop the disease or develop symptoms, much of the symptoms are associated with an acute illness that's really characterized by a very itchy, extremely itchy rash, sometimes accompanied by fever, body aches, joint aches. But one of the hallmark characteristics is this rash that happens.
And then, of course, the babies. What is happening with the babies?
So that's a very different situation. So in people who are infected, many times the infection is cleared over a period of time. There is two problems that we've now learned about that can happen. One is neurological complications. This may happen 1, 2, 3 weeks after the initial infection. And this is an autoimmune process, what we call Guillain-Barré syndrome. There are also other neurological manifestations that can occur. The risk is relatively low, but these can be life-threatening types of neurological sequelae or complications. In women who are pregnant, in what the studies are now showing is that during infection, particularly in the first trimester, which is a very important time for development, there can be vertical transmission, or transmission of a mother who develops gets an infection and they can transmit it to their fetus, and then the fetus can then the virus in the fetus can impact on development and cause congenital malformations. And this is the microcephaly, this outbreak of microcephaly that we've experienced in Brazil, and now that is potentially spreading throughout the Americas.
You brought some pictures with you that I want to take a look at, and here's the first one. Dr. Ko, what is this?
So this is a CT scan, or a computerized tomogram, of one of our patients. This is a baby who was born with microcephaly, which is a baby with a small head, or a head smaller than normal. And what it's showing here is that usually you can see what we call calcifications. These are building up of calcium deposits inside the brain tissue, and those are the white sort of rows of the white rows which are inside the skull. And those are abnormal, or these are pathologic. These are usually due to inflammation or products of inflammation. These are actually very severe findings. They can cause many times many types of manifestations, such as foci of seizures in these babies.
So these children will never be right.
Yes, that's unfortunately true. There'll be, the prognosis of this, and this is, again, we're in the beginning of this epidemic, and we're following. And actually, this is one of the goals of our research, is to really see what is the damage and what is the prognosis of these babies.
And we're still
who are
learning
born.
about it. And here's one of the bababies that has been born.
So this is actually Adriano Matos, who's one of the pediatric neurologists on our team, and we've set up services within the hospitals that we're working in to follow these babies and to find out, what are the types of complications that they're suffering, how best we can care.
Because this is all new. We have no idea.
This is all new.
Whether the babies grow, whether they, have seizures. And you brought one more picture. What is this?
And so this is actually this is looking into the eye, and this is of a baby. And this is what we call the retina, which is the tissue which actually is important for vision. And the tissue is usually red. And you can see patches of normal tissue, but you can see these white scars. And you can see that these are white scars in large proportions of the retina. And so these babies not only will have cognitive and developmental defects, but they will also have visual problems, impaired vision, as well as impaired hearing.
What do you think the recommendations are going to be for women traveling? We don't know how explosive this is going to be. We obviously know in the Americas it's explosive. It's explosive in Brazil. How many cases there now?
So in Brazil, there are over 5,000 suspected cases, and now of cases which they believe, based on clinical and radiological evidence, is about 1,000 at this moment.
Is our government throwing enough money at this, do you think?
Yes. Well, the government there's a very important measure in Congress right now, which has been supported by President Obama, or proposed by President Obama, to invest $1.9 billion in this disease.
That's a lot.
That's a lot of money, and it's an important initiative in the sense that this is a disease where it's a new disease. We don't know very much about it. We don't know how to diagnose it well, and we need adequate or improved diagnostics. We don't have any way to treat it, and we have no way to prevent it, as evidenced not only by the spread of Zika virus throughout the Americas, but also other mosquito-borne diseases such as dengue and chikungunya, which have been emerging infectious disease threats. There's no vector control, has been actually uniformly failed throughout the continent. So what we need to do is to really come up with new innovative solutions in order to address this, especially this disease, which affects pregnant women, vulnerable populations, pregnant women and fetuses and infants.
As an infectious disease expert, is this really interesting to you because we don't know so much about it?
It is, yes, it is really interesting. This is a new pathogen. This is something completely unexpected. When we first had the epidemic of Zika virus, which just caused rash, we thought that this was going to be like dengue or chikungunya, many of these other diseases. It will come and it will go away. What caught us by surprise was really these neurological manifestations, complications, which can many times be life-threatening, as well as the microcephaly, the outbreak of microcephaly that's occurred among newborns. So this has caught us off surprise. I think more importantly is that this virus, because of the ability to be transmitted by mosquitoes, has spread rapidly throughout the Americas. And for us, importantly, both as Americans but also citizens of the Americas in the world, this has hit many of the poorest countries in the continent. It's Colombia, Guatemala, El Salvador, Haiti, important regions in underserved populations in the Americas, such as in the United States, such as Puerto Rico. And so you can imagine the impact and the burden that this disease will have in terms of the population, the families, the health system, in terms of not only diagnosing, treating, taking care of these babies, but and the pregnant women.
How worried are you about Puerto Rico and the spread there?
Well, there's an ongoing epidemic right now that's occurring in Puerto Rico. Cases have been identified, they've been confirmed. Fortunately, this is not the high intense season for mosquito-borne transmission, but it's likely to spread very, very well. It's a high population center in the United States. It's also, as you know, and it's a territory of the United States which has many economic problems in terms of its
terrible
debt
economic problems right now.
So we are quite concerned. CDC appropriately has, intensified their efforts, their prevention and control efforts in Puerto Rico.
Why did you pick the particular subject of slums in Brazil, and why did you center on that? Well, what was it about
that's a story that goes back 20 or 30 years. As a medical student, I was very much, my parents are immigrants from Korea. My father had tuberculosis, very much was aware of the impact that infectious diseases, but also the health problems of developing countries. So as a medical student, it was my, my passion and my vocation to work on diseases of poverty or diseases at the interface, particularly of infectious diseases and infectious diseases and social justice. And the place I chose to work with after I finished my training was to work in Brazil, where because of rapid urbanization and issues of social inequity, there are large populations living in slum communities, many of them marginalized from the health services, where many epidemics occur, such as Zika, but many other types of epidemics.
Well, Dr. Koh, we wish you luck. We've got to get a vaccine so we can wipe this out. That would be great. And thank you for the work that you're doing.
Well, thank you very much, Anne, for the opportunity to talk and come to your show.
You're welcome.
Okay.
When one listen, who's this girl? Spend all night kissing and the bottle's right here, then who else is missing? Got a little sidetracked if I'm so wishing to find the keys to the door, but it's also a metaphor. Need to keep locked in the grocery store, but mine just to save time. Skip right ahead to the last ride. The harder we look,